Hola a todos. Hello, everyone. My name is Eloisa, and today I'll be talking about how to simulate epidemics with Python. So firstly, a little bit about me. I'm a modeler and developer at the Bennetts Institute, based in Melbourne, but living here in Spain. And what I basically do is I make simulations of infectious diseases on one hand as a mathematical modeler, but on the other hand, as a research software developer, I build the tools that make this possible. So the back-end infrastructure that allows us to build these simulations easily. I'm also a contributor to Atomica, mainly. Atomica is the Python package that I'll be talking about today, which we use to simulate epidemics and many other things, but also to Cyrus, StarSim, and as of very recently, CPython, which I'm very happy about. And I like hugging goats, because honestly, who doesn't? So a little bit about infectious diseases. A lot of people don't know this, but they're actually the third biggest killer worldwide. So if we count all causes of death around the world, including cancer and car crashes, infectious diseases come number 3. Last year, 13 million deaths, more than 13 million deaths, were caused by infectious diseases. This in 2019 was 14% of deaths, but that has only increased and increased every year, especially since the onset of COVID. Now, we do have a series of tools in place and strategies in place for stopping the spread of infectious diseases and stopping them from getting to epidemic and then pandemic levels like we saw with COVID. However, it's not really that straightforward. So we do have 3 main kinds of public health interventions. Namely, we have vaccines, then tests, and also treatments or medications. However, it's not always very clear which is the best approach. We also often have very limited funding, so it's not like we can just do everything and see what happens. We have to choose, and we have to choose wisely. We have to be strategic about this. And this is where mathematical modeling comes in. So instead of just trying things out in the real world with real consequences, we can just run a simulation that approximates the real world, and that can give us very important insight into what kinds of interventions work best. That allows us to determine an effective approach without having to get to the point where real people have gotten infected and potentially died from this particular disease. The problem, however, is that it's actually quite hard to build these epidemic models from scratch, especially because they do have to be fit for purpose and tailored to each particular situation. So different diseases are very different, but even for the same disease, we might need to actually have a very different approach in one country versus another country, because it depends on the country's infrastructure. It depends even on how people interact. Even cultural things come into play. Sometimes once you get deep into it, you realize that you really, really have to tailor the model to the particular situation. So how can we make this easier? We want to make this approachable and accessible to people so that more and more people will use mathematical models for these situations, because it is important to make informed public health decisions. So this is where Atomica comes in. Atomica is an open source simulation engine, so it's a Python package that is made for simulating mathematical models, specifically compartmental models, but I'll explain what that means in a second. It's easy to use and highly configurable. So it has inbuilt functionality for a whole series of things, and we can mix and match whatever works for us without having to go into the parts that don't necessarily apply to us. So this includes functionality for running simulations. It makes it really easy to just build a model and run a simulation quickly. There's also support for fitting model parameters to the data, implementing public health programs, and optimizing budgets. So for example, if we have a whole series of interventions that we're thinking of implementing, we could get Atomica to tell us, okay, well, the most efficient and optimized way of using your budget is spend 20% of it on tailored testing to specific populations that are high at risk, and then another 30% on treatments of the specific type. And, we can get more and more complex with this, but that's the basic idea. And also plotting. So if we don't feel like building our own plotting routine, it already exists in Atomica. It will show us all of the main important stuff. So the idea is to make it accessible to all levels, to someone who wants to make a very simple simulation and someone who wants to make a very complex model, as a contract to a specific country that wants to increase, the amount of treatment for tuberculosis, for example. And I think one of the good things of Atomica is that it's developed by people who are regular Atomica users. So we know the user very well since we're one of them. And that creates a constant feedback loop of improvement, because through using the tool, we can kind of go, okay, this part is kind of something that I need to repeat every single time. Maybe we can incorporate that into the Atomica package so that this step is easier and also other people will benefit from that. So now let's look at a hypothetical disease, snakepox. So we've had chickenpox, we've had monkeypox, and now snakepox. Don't worry, it's completely hypothetical. I don't want to scare anyone. But let's say that it's been around for a few years, and maybe it's been eradicated in most of the world, but there are still some pockets around the world of very high prevalence. They just can't manage to get rid of it. But now there's a new vaccine, and maybe a government from that vaccine has reached out to us, the modeling team, in order to make a simulation and see what impact this new vaccine could potentially have in their country. So they're asking us whether it would be worth it for them, essentially, to implement a big rollout of this vaccine in their country. And here we have a simple compartmental model, which is what we use in Atomica. We only use compartmental models. And what that means is that we have compartments, which are these green boxes, and we have flows of people flowing from one to the next. The compartments just represent amounts of people. So in this case, we have susceptible, and the amount of people in susceptible flow to infected via the infection rate. And then the infected people then slowly start flowing towards recovered by the recovery rate. This is called the SIR model. It's basically the simplest possible compartmental model when applied to epidemics. I'm going to add a little bit more detail just to make it a bit more realistic. So we're going to have births mediated by the birth rate, and also deaths mediated by the death rate. And there are two death rates in this case, the death rate due to infection and the death rate due to all other causes. So, okay, what now? How do we go from this conceptual flowchart to having an actual simulation? Well, first I'm going to walk you through the Atomica modeling process, step by step. So firstly, we have the framework, which is this kind of the graphical dynamics of the disease that I've just showed you, and we translate that into an Excel spreadsheet so that Python can read it more easily. And then we have a data book where we input all of our data. We input all of that into Atomica, and we run a simulation. This, however, is only a preliminary simulation with preliminary results. It's not ready yet because we still have to do the model fitting. We have to fit the model to the data. Otherwise, it's not going to give us accurate results. And this gives us the status quo scenario. It means what will happen in the future if we keep doing things the way we've been doing them up till now. And finally, this is for me the interesting part, we get to simulate a bunch of alternate scenarios of what would happen if we did this, what would happen if we added a new vaccine, what would happen if we changed the funding level, the budget, what if we increase testing or decrease testing, or test a specific vulnerable population more than the general population. So there are many options and many ways that we can play and experiment with this. So let's get into it. Firstly, we're going to make the model framework. As I just explained, it's just the framework structure translated into Excel so that it's interpretable by Python. And this is what it looks like. So we've got an Excel spreadsheet with 3 pages The first page is the compartments, and that simply contains each of the compartments in the model listed. So in this case, we've got births, susceptible, infected, recovered, and deaths. And we're also kind of in this last column indicating that there is going to be data that it relates to a couple of these, like the susceptible and the infected are going to have data, but it's not going to be here. It's going to be in the data book in the stocks page. So we're just telling Atomica where to find that. And then the transitions. So the transitions page basically shows us where the flows are. So where they point from and to. And this always goes from rows to columns. So in this case, from births to susceptible, from susceptible to infected, and so on. And finally, we have the parameters page. So this is going to contain the values for all of our parameters or where we can find those values. So in most of these cases, I'm just telling Atomica, look, for most of these, just go to the data book into the flows page, and there you'll find the relevant information. However, for one of them, I have included it here as it's a function of the others. So the force of infection in this case is a function of the amount of people susceptible, infected, recovered, and of the infectiousness. And also we can add extra parameters. So if we feel like it's useful to us for calibration later on, or even just a quantity that we would like to have, just so we can look at it at the end and compare it in different scenarios, we can just add that here. So in this case, I've added the incidence, which is defined as the number of new infections per time step or per year, and also the disease deaths. So that is the component from infected to deaths. Remember, we had 2 death rates. We're only looking at the component that is deaths due to disease. And now the data book, it just contains all the data values for the stocks and flows. Stocks is a synonym of compartments. It's the same thing. So I'm not going to go into this in too much detail, but essentially we have the amount of people alive, which is the total susceptible plus infected plus recovered. And that's why we don't need data for recovered, because it's just going to calculate it based on the other 3. And we could have lots of data points, little data points. In this case, I have 2 data points because it's a very simple example. And the same goes for the flows. So these are the flow rates from one compartment to the next. We can set them as a constant rate. We can set them as 1 data point, multiple data points. If we wanted to, we could have a time series going all the way back to 1960. For some models, that could be useful. For this very simple model, not necessarily. So we've simplified this. And now to running the simulation. Firstly, I want to just show you a little bit of how this works under the hood so that we know what's happening when we actually run the simulation. So the important quote-unquote compartments are susceptible, infected, recovered. So those are the amounts, those that have like an amount of people in them. The births and deaths don't really have an amount of people in them. They're like what's called sinks, or, you know, people just kind of appear. We don't really care how many people were like unbirthed before, so we're not going to look at that. The important part is that at time equals 0, we have in the data book, there are 1,000 susceptible people, 500 infected, and 0 recovered. And the algorithm that does the integration at each step of this simulation, it doesn't have any information on the previous time step. So what it's going to do, it's just literally going to take exactly the values that we've set for the initial time step and use those. So it's going to match that exactly. But then for every subsequent time step, it's going to use the previous time step, look at the flow rate, do an integration, and that way at each step, it's going to see, okay, so these many people flow into susceptible from births, but then some flow into infected via this function, and then 10% per year flow into deaths. So then, you know, I'm going to make this calculation, and okay, this is the new number of people that are susceptible. And at each step, it's doing that. It's making that calculation. So now we're ready to do that. First thing we need to do, of course, is import Atomica. And then we're going to load in the framework and data book that we've just created. We're going to load them into an Atomica project object. So this project is simply an object that's going to hold information, all of the information pertaining to our project. So it's just so we have everything in the same place. And then very easily, we run the simulation. We just go project p.runsim, give it a result name. And as you can see, it runs very quickly. That's because this is a very simple model. It does not always run this quickly. And in case you're curious, this is the code that I use to plot. So again, very simple inbuilt plotting routines. I just made a plot data object with the result and my project. And then I went, cool, I want you to plot a series and it's going to have my simulation and my data. And that's all we're telling it. We're not telling it which parts of the simulation to run. It knows. It just knows that it needs to plot susceptible, infected, and recovered. So the continuous lines are our simulation and the dots are our data points. It might be a little hard to see because it's right on the y-axis, but if you look at 2015, which is t=0 for our simulation, we have the data points and the simulation. The simulation matches the data points exactly. That is by design. It's what I was just talking about, where at the first time point it matches exactly, but then afterwards we can see it doesn't match at all. This is because we're still missing a step. We still need to do calibration. So we're going to fit the model. And the reason we need to do this is because often we have data that comes from a lot of different data sources and the data might not meld together exactly. Also, some organizations use different definitions to other organizations, so that can increase complexity. But even without that, models are always an approximation of reality. So we're always going to have this situation where the first time we run things, they don't really match exactly. We do need to do this step. We could do it manually. We could just go in, change a parameter, run it again, look at the plot. Oh, it needs to be a little higher. Okay, well, and do that whole iterative process. But that takes time, and honestly, a robot can do that. So we're just going to do that automatically. All we need to specify is which parameters we want to adjust and which simulation outputs we want to match to which data. And we do this in a particular order. So we always start with the largest parameters that have the biggest impact on the simulation. So we start off with population, and then the disease parameters, and finally disease deaths. The reason is because if we started off by calibrating the disease deaths, we would have the problem where, maybe we've perfectly calibrated the disease death rate. Here we have the parameter names to match the number of deaths. But then if we change the birth rate, we're going to have more people in the simulation, we're going to have more people infected, and then we're going to have more people dying as well. And suddenly this parameter that we perfectly calibrated is now completely off. So that's no good. And that's why we do it in this particular order. Now we can actually go on to the model fitting. So firstly, we're going to make a parse set, which is simply a copy of our parameter set. This is just so that we don't modify the original data. So we still have our original data and our original parameters, but we're going to make a copy that we can edit and change as much as we want, so we don't have to worry about changing what we had originally. And now these 3 lines of code are essentially the exact same as this table, just translated into code, where first we calibrate the population, then the disease parameters, and then the disease deaths. And finally, all we need to do is run the simulation. And I'm going to give it a result name, calibrated. And this is what that looks like. So as you can see, this looks a lot better than the previous run. We can see that now the simulation actually matches the data. And this, what we see here is the status quo. It's a plot of the status quo of what would happen if we kept doing things exactly the same way we're doing them now. If we don't change the budget, if we don't add or remove any interventions, everything stays the same. So as we can see, the number of infected people is increasing, and that is not what we want. So maybe we want to look at an alternate scenario. What would happen if we shake things up a bit, do things differently? So here we can see that, in Atomica, we have integrated support for a whole series of things, including interventions. So this means public health programs, changing funding levels, and even optimizing funding. So as I was saying, we can do a routine where we get Atomica, we give it a list of different possible interventions, and it will choose not only which interventions to implement, but in which percentages, which percentage of our budget we should dedicate to each one. However, that is a little bit complex to discuss in this short session, so I'm going to take a little bit of a shortcut. If we look at what public health programs do in Atomica, what they're really doing is they affect future outcomes by modifying certain model parameters. So really, just as a demo, we can just do that ourselves. We can just modify a parameter and see what happens. So that's going to be our shortcut. We're going to modify it straight in the data book. Here's the data book again. And let's look at this parameter that I've circled, the disease recovery rate. It's 0.3. And let's remember the context we're in is we're looking at this vaccine, this new vaccine that we're looking to see what impact it could have. And let's consider that maybe this vaccine, it doesn't even stop you from getting the disease. Maybe you still get the disease. Maybe it doesn't even decrease your death rate due to the disease. If you are vaccinated and you get the disease, you have the exact same probability of dying as anyone else. So maybe it doesn't even change that. Maybe it doesn't even change the infectiousness. If you're vaccinated, maybe you have the same probability of passing that infection on to someone else while you're infected. But we're just changing one thing, the disease recovery rate. So instead of being 0.3, it's going to be 0.6. We have doubled the disease recovery rate. So all that we're changing is when someone gets infected, if they're vaccinated, they recover twice as fast. That's the only difference. So let's see what happens. This was our status quo, and if we run our alternate scenario, this is what we see. So up to that data point in 2025, everything is the same because up till then, we haven't implemented the intervention yet. We implemented the intervention, as you can see, in 2026. So up till then, it's all the same. In 2026, we implement the intervention, and we can see that things suddenly change. The number of people infected, instead of steadily increasing, it suddenly starts decreasing. The amount of people recovered, of course, also increases. And one of the interesting things is that actually the amount of people susceptible also increases, even though we didn't change the infectiousness. This is because if people are infected for a shorter amount of time, they have less time to pass on that infection to someone else. Even though the infectiousness itself is the same, they have a shorter amount of time to pass it on, and therefore there are more people that never even get infected at all. So this is a very positive outcome. And we're also going to look at the difference in the number of new infections and number of deaths due to disease. So on the left, we've got the status quo, what we saw first, and on the right, the alternate scenario. So as you can see, in both cases, we've both decreased the number of new infections and the number of deaths due to disease. In particular, new infections decreased by 27% and disease deaths by 34%. This means that during the course of the simulation, we saved 1,075 lives. And remember that this was with an original population of 1,500 people. However, I do want to introduce a quick caveat. This isn't a magical crystal ball that's going to tell you what happens in the future. That's not the purpose of this. The purpose is to show the overall dynamics that are likely to play out under different conditions. So we can't really say that if we did put this vaccine in place, we would have exactly saved 1,075 lives. But if we model several scenarios and we consistently see that in one type of scenario, we see a better outcome than in another type of scenario, then probably that is what is going to have the best result in the real world and have the best public health outcome. So let's look at some real-world applications. So my team and I have been using Atomica for quite a while, and we've used it for research on, firstly, infectious diseases, of course, including COVID-19, tuberculosis, typhoid, hepatitis C, and so on. But it can also be used for other things outside of infectious diseases. Recently, for example, I was working on a project on maternal and neonatal health, and we were looking at things such as maternal mortality, even the impact of neonatal nutrition deficiencies and the ongoing impact that can have in later life. So we can look at many things that go outside the realm of epidemics, pandemics, and infectious diseases. Another one that I found really interesting, there was a hospital that reached out to us and they asked us if we could do an optimization of funding allocations for sustainability interventions in their hospital. So they had different ideas like changing the light bulbs for more sustainable light bulbs, putting in solar panels, putting in training for medical personnel on how to recycle certain types of medical material. And that was really interesting because it's a completely different domain, but you can use the same theory and the same tools to solve that problem and optimize that problem under limited budget constraints. And many, many more that I won't have time to go into today, but feel free to come to me after and ask. And all of this research is used to inform public health policy and global health programs around the world, including in collaboration with the World Bank and the Global Fund, among others. So, for example, the Global Fund, for example, gives out grants to countries that they don't have to pay back, but they just have to kind of show how they're going to use that money, just to, say there's a country that they want to deal with a typhoid epidemic and they're asking for a loan. They just have to show what they're going to do and kind of prove that that's actually going to have a positive impact. So they reach out to us and they ask us, if we get this grant of X amount of money, what is the best way to use that grant? And then we're able to help representative in those countries, and we collaborate together with people in different parts of the world to create programs that are actually going to have an impact instead of, years ago when we didn't have these modeling tools, we would just have to try something and see what happens with real consequences, which is unideal. So that's the kind of work that we're able to do. And I'm going to give you a real world example. So this is a case study of tuberculosis in Belarus. And from left to right, we can see we have the number of tuberculosis related deaths, number of new active tuberculosis infections, and the number of people with drug-resistant tuberculosis. So drug resistance is actually a massive, massive problem in Belarus. I think as of the publication of this paper, they had the worst, highest prevalence of drug-resistant TB in the region. So it's a huge problem for them. And I find this paper really, really interesting. This was one of the studies that was done within my team. It's really interesting because it's the same funding level. So the gray line is under current conditions, current spending, and the red line is the same budget optimized by Atomica. So it's the same, with the same amount of money, they managed to halve the amount of tuberculosis deaths and halve the amount of active TB infections, and also decreased drug resistance, because the more people are infected, the more drug resistance. So I think that really speaks to the power of these mathematical modeling tools, that we're able to find the optimal way to tackle these problems that are so complex that if we were just going to do it by hand, it would be completely impossible. So I hope the takeaway today is that Atomica is a very useful mathematical modeling tool that can be used not just for simulating epidemics, but also a whole range of other topics, and that when applied to this area, we can save many lives and have a very positive public health impact. If you're interested in learning more about Atomica, this is open source, so we have, you can check out our GitHub. It's atomica-team/Atomica. You can also download the package with pip if you want to play around with it. There are many tutorials that have been published. There's very, very comprehensive documentation, and the tutorials go into detail into things that I didn't have time to cover today, like, for example, how to deal with having multiple populations in your model. Even, for example, with malaria, we could have a population of people and then a different population of mosquitoes. Or populations can also be different age groups or key at-risk populations, like people living with HIV. So there's definitely a lot to play around with that. And here you can also find a series of studies and reports on different modeling studies that we've done throughout the years, in case you'd like to see how they've been applied to the real world. Finally, I'm going to put a QR code at the end where you can access all of these resources, and you can also see the Jupyter notebook that I used to generate all of these plots, so you can play around with that yourselves. And here it is. Feel free to connect on GitHub and or LinkedIn, and thank you very much for being here. I think there's some time left for questions, so if anyone has any questions, I'd love to answer them. Yeah? Oh, sorry, I think there's a microphone that they're bringing. También me puedes preguntar en castellano si te va mejor. O sea, yo hablo los dos, pero tenía esto en inglés. Bueno.
Hi, thank you for the talk. Very interesting. How do you validate your models? Like, do you have to rely on like letting time pass and see how it evolves to validate that the model is correct, or how do you like you can fit your data, but after that you have to, I guess, validate in some way?
Well, the calibration part is kind of the validation. Like, if we can get the model to reproduce historical data, that is a pretty clear indication that the parameters are correct. Because, I mean, this was a very simple example. It was maybe a bit under-constrained, but in a lot of cases, you know, where we have time series data for a lot of different parameters or different values that, you know, span years, if they're all fitting quite well, that's a pretty clear indication that, you know, if it's reproducing the historical data, it will reproduce the future data. But we do also, for a lot of these, you know, we'll do a study for a particular country that's asking us for a modeling study, and then a couple of years later, they'll ask us to redo it and update it. And then we can, see how effective and how accurate the model was for the last couple of years, and also update it with new things that may have happened, new, you know, other things that have changed in that particular country or area, and then make it even more accurate. No worries.
Yo te la hago en español.
Vale.
Son dos, ¿vale? La primera, en los casos que has puesto no se manejaba el periodo de inmunidad. Sí que Atomica permite manejar el periodo de inmunidad para saltarnos esa asunción de que los recuperados no se pueden volver a reinfectar.
Sí, este era un caso muy básico, pero sí, ahí tú puedes poner las opciones que tú quieras, diseñarlo como quieras, depende de la on the disease, ¿no? Pero, por ejemplo, tenemos algunos casos en los que a lo mejor es susceptible, infected, susceptible, que a lo mejor susceptible, infected, waning, que es como immunity is waning, you're still a bit immune, but only for a while. Y entonces vuelve. Entonces, tú eso lo puedes poner como tú quieras, simplemente cambiando pues, los labels en el Excel.
Vale, o sea que permite varios modelos compartimentados. Bueno.
Exacto.
Y luego, a ver, todo esto se basa en en ecuaciones en derivadas parciales, ordinarias, perdona, y hacéis al final un poco de forecasting para ver cómo va a evolucionar en esas simulaciones y demás. Sí que lo que te dice el teorema de Lindelof y lo que te dice el teorema de Caratio-Oderi y demás es que a medida que tú vas haciendo ese forecasting, el riesgo de la equivocación es altísimo. Entonces sí que hay como una especie de confianza en ese tipo de predicciones a posteriori de los datos que tenemos, o eso es algo que todavía se está trabajando un poco.
Bueno, a ver, en cuanto a forecasting, o sea, es simplemente sí, ODE is lo que tú has dicho, que en cada caso, en cada paso de la simulación hace como una derivación Euler.
¿Sí?
Entonces, claro, si hacemos una simulación de 100 años, pues habrán otras cosas en la sociedad que han cambiado que no podremos saber, ¿no? Entonces sí que es verdad que si hacemos una simulación que es muy, muy, muy larga, pues sí que aumentan las chances de que no sea tan acurado, pero en general para los tiempos que nosotros miramos, incluso de hoy a 2050, no es un tiempo tan largo como para que eso tenga un gran impacto realmente.
Perfecto, pues muchas gracias y muy chulo.
A ti, gracias.
Creo que no hay más tiempo, ¿no? Quedan 5 minutos y son para cambio de poner.
Ah, vale, ok. Bueno, pues muchas gracias.